Welcome to San Joaquin Spotlight, a public affairs program featuring conversations about life in the central San Joaquin Valley. This program is brought to you in partnership between KFSR 90.7 FM and CMAC Fresno. I'm your host, Sevag Tateosian. Today in the studio, we have Dr. William Schiff. Dr. Schiff, welcome to the program.
Thank you.
Before we get into the nitty-gritty about what we're talking about today, tell us a little bit about yourself. So off camera, you made a comment. You've been living in the area for over 40 years, something like that?
And I still got lost on the way to the studio, yeah. I came to town about 57. I'm a third-generation urologist. Went to school, high school here, then left for college and medical school and some training, and came back in 1988 to join my dad's practice in urology.
You have a very impressive resume. Before the show, I was reading it. What made you decide to come back to Fresno? I mean, someone with your resume could have easily been picked up in all over the nation, actually.
Well, I was picked up all over the nation. That's why that's why I was hiding here. No, I grew up in Fresno, and I wanted to join my dad's practice, and it was an obvious decision for me to make. Spent a lot of time in Los Angeles and in Chicago, and at that time did not want to practice in a bigger city. Liked the idea of the kind of practice that my dad had, and that I hoped that I could assimilate into, and that was the genesis of that move.
Urology. What are we talking about when we talk about that word in medicine?
Well, urology is a subspecialty area of medicine that encompasses both surgical and medical treatments of kidney, bladder issues, sexual dysfunction issues, which is my real area of interest and passion. We take care of men and women. The subspecialty of urology has really transformed into several other subspecialties, pediatric, cancer or oncology, neurologic issues in urology, and male and female issues in urology as well.
You know, is it still taboo, or is it still kind of embarrassing to talk about when you're talking about sexual dysfunction issues in men and women? Because years ago, I mean, it may be different for you in your practice, but years ago, you know, I would giggle, or people would giggle about, you know, that kind of thing. But now, is it becoming more and more common to talk about?
Well, certainly more and more common. I think that the use of pills that have been advertised in the media, enhancing sexual function, certainly in men, have raised everyone's awareness. We've had prostate cancer is a big issue, and oftentimes treatment for prostate cancer will result in some changes in sexual function. And as male exams in general, and men being aware of their medical needs being more common, and certainly people talking about that, people are more comfortable with it. And so it's been a natural progression. When I started out in the 80s, yeah, sexual dysfunction issues were something that people would talk about in a roundabout way. I had patients who would say, well, it's my nature, or I have lower back pain. And I was trying to figure out, well, I'm a urologist, I'm not an orthopedic surgeon. I'm not sure what nature means. And finally, my dad clued me into, well, they're talking about sexual function. With the advent of all the treatments for men, now women have come on board, and it's okay to talk about sexuality, and it's okay to seek out treatments for that. So we're really seeing the whole gambit of sexual function concerns coming of age, if you will. So it's not uncommon now for people to seek out help.
So I have my regular doctor. When would it be time for me to come see someone like you or a urologist? I mean, can't my doctor handle some of this stuff?
Yes, and we hope that your regular doctor, your primary care physician, will be attentive to basic urologic needs for both men and women. And there are a lot of things, screening, treatments of bladder infection, treatments for prostate infections, simple things that can certainly are within the armamentarium of primary care physicians. what happens in sexual medicine is a little bit of a different animal. You have to have a comfort level in asking the question. You have to have an environment in the office with your staff where patients know it's okay to ask that question for men and women. And so there's a little uptick, I think, in expertise when we talk about treating sexual medicine, when we compare it with primary care versus subspecialists. There are people who just don't want to handle it. There are people that don't want to get in the conversation, both physicians and staff, and that sends the wrong message to patients. So as far as general thoughts on, here you have an issue, whatever that issue is, let me give you some pills. And we all know what those pills are. And sometimes that works, and that's great. In fact, the vast majority of times it will work. The problem is when we deal with primary care physicians and patients who are both parties are uncomfortable with addressing the issue, and at some point in that conversation in the exam room, the question is brought up somehow, happenstance, and it may be in the last 30 seconds of the interview or the exam, so you really can't dissect what the actual issues are. And when you get treatments that are, well, let me go to my knee-jerk reaction and give you a pill, there are going to be a portion of people who are dissatisfied. There are going to be a portion of patients, both men and women, who are going to be disenfranchised because they haven't been given the right pill. Their issues have not been addressed. That is my concern, and that was really one of the emphasis that we had, or the impetus that we had in developing DOSH, our Department of Sexual Health. It was an environment that people could come to, feel comfortable with hearing my staff and hearing myself ask the question and feel comfortable in giving out an answer, and helping us dissect with the patient what the actual issues are. And it's really multifactorial, and I often say in our lectures that this is not a clinic for an injection or a pill. It really is a holistic approach, a well-being approach, if you will, to sexual medicine for both men and women.
In terms of men, what are some of the causes of these issues?
Well, Fresno County has bad air. We have a population that is really not healthy from a heart-healthy standpoint. So obesity, smoking, alcohol, stress, all these things that all of us are subject to and have experienced at one point or another. Those are all basic etiologies to sexual function issues. Heart-healthy lifestyle. So anything that is not heart-healthy is going to place us at risk for sexual function. We have data. We have a lot of data in men, and we're not as well-versed and supported by data with treatment in women, but we believe there are parallel concerns.
When you're talking to a client or a patient, or you're out lecturing about this topic, and you tell them some of the reasons why this issue can happen, do they say, wow, I didn't realize that? I mean, is there some misconceptions out there?
You're absolutely right on, and it is mind-boggling for people, for me to listen to our population, to listen to our patients, and they've come in with a whole variety of medical issues, and for some reason they have isolated sexual function as something that should not be affected by the things that affect all of us, whether it's a stroke or a heart attack or obesity or diabetes or high blood pressure. Why is it that I should have all these problems but still can be active from a sexual function point of view? It makes no sense to me. So yeah, I'm surprised of my patients' response. And these are patients of all levels of education, of all socioeconomic strata, that there's a disconnect. They're not understanding that they really have control over their sexual health if they choose to. And that's the cool thing about what we do at Department of Sexual Health, is an educational aspect. So in one hand, I'm surprised that people are not making that connection, but it gives us an opportunity to help them make that connection.
Let's talk a little bit about women. Now, you know, I read somewhere that if a woman is on birth control type programs, it may affect her in the future. Talk about that.
I am lucky enough to do a lot of lectures on college campuses, and we're seeing young women, 18 to 28, 30, who are healthy at their prime from a health point of view, certainly prime from a sexuality point of view, but their libido, their interest in sex, their desire for sex, their response is not what they want it to be. It makes no sense, but a lot of time, a lot of individuals in that age group are exposed to birth control pills, and certain birth control pills can affect, downregulate hormones that are necessary to support or improve sexual function. So we've got a young, healthy population that should be at their prime, but because of what they're trying to do and prevent pregnancy, they're actually hurting themselves. There have been a lot of changes in the pharmaceutical industry and how those birth control pills are made, and anyone who is listening to this discussion and having some concerns, don't stop taking their birth control, but talk to their primary care doctor, talk to their gynecologist who's prescribing these medicines. And if they're actually having an issue, it's a real issue, and it's a physiologic effect of some of these pills.
You know, we're going, related to this topic, and we talked about it a little earlier, is the fact that people are hesitant to come out and tell their doctor that they're having these issues. What's your message? I mean, for our audience members watching this program or listening to this program on radio, what would be your message to someone that's hesitant to talk to their own doctor about this issue?
Oh, that's a softball question, because the message is this, is that you're not alone. You're not alone. 40% of us over 40 men are going to have some testosterone issues that could be leading to a problem in sexual health.
Can you repeat that? I don't mean to interrupt, but you just told me 4 out of 10 men.
That's 40%, yeah. 4 out of 10 men over 40 are going to have these issues for a variety of reasons. As we get older, the percentages are the same. The reasons may be different. It may be a vascular issue, a blood flow issue, a neurologic issue, and in many of us, a psychosocial issue. There's the entire psychology behind sexual health. So the message is that clearly you are not alone. That's primary. And the secondary issue is not only are you not alone, but it's a fixable event. And with that, those are two great messages to hear, because it gives people, it empowers people to try to fix it if they choose. It empowers people to be educated, and it empowers people to make informed decisions on what they want to do. Not everyone has to have an active, frequent sexual lifestyle. But for those of us who desire to take that course and believe that it is an appropriate aspect of our lives, an important aspect of our lives, there are things that can be done. And that includes simple, it doesn't imply that everyone should be on a medication or an injection or hormone supplement, because that's not for everyone. But it does imply that they should ask the question of themselves, are they happy? If they're not, let's do something about it. And those changes that can impact people in a positive way may be as simple as losing weight, diet, exercise programs, or talking to someone who's been there before. We have a lot of patient educators who do a great job in just listening. They're patients. They've been treated, and they can listen because they've had the same concerns. We also have not only access to trainers and nutritionists, but we have access to sex therapists, people who do this for a living. And there are a lot of things a lot of positive, a lot of good things that can come out of those interactions.
You know, as I sit here and listen to you, and I did a little bit of research on you too, so I did my homework, you have a lot of passion for this stuff. I mean, you have a lot of passion towards educating the population. Why? I mean, you could have selected many other areas, but you've educated yourself, you've studied real hard in this area, and I genuinely think you want to help people in this area. Why?
Oh, well, thank you for that observation. A couple things. As I mentioned off camera, I'm third-generation urologist. And what started me off in high school and in college about wanting to become a physician and wanting to follow my father in his footsteps was observing that passion. He called it the art of medicine. And with all these things that I'm not allowed to talk about politically that are occurring, with insurances and issues in Washington dictating how we manage our professional lives, the art of medicine has been lost for a lot of us. And the development of DOSH, the development of the Department of Sexual Health, has given me a tremendous pathway and an ability to practice that art of medicine and through education, through empowerment, grabbing those disenfranchised and bringing them back. That's the cool thing. That's my golf. That's driving a sports car. That's what I love to do.
That's your Porsche.
Yeah.
I want to ask you about some issues that men and women face with leakage,
Okay.
urinary leakage. Talk about that.
Urinary leakage, urinary incontinence. It falls into a category of my lecture series of quality of life issues, and the two quality of life issues are bladder function and sexual function. And about 30% of the time in men and women, one usually follows the other, meaning that if you're having some bladder dysfunction, that's usually associated with sexual dysfunction for a whole lot of hormonal and physiologic reasons for both men and women. And so urinary leakage is something that, one, is also very, very common, and two, very fixable, and something that even more so than sexual function is something that was at one point taboo to discuss, and at one point kept a lot of men and women from undergoing life-saving pelvic surgical procedures for fear of that negative outcome or that adverse outcome. So bladder dysfunction, urinary leakage, has a whole bunch of etiologies, a whole bunch of reasons why that occurs. It requires someone, again, who can ask the question, someone, again, who works in an environment where that question and answer relationship can be done comfortably, and then categorizing the reasons why people are leaking, and then very easily after that, assign certain treatments for the appropriate category.
So can I request, or can I or someone out there request you? I mean, can we say, I want Dr. Schiff to see me? I mean, how does that work for those of us who are not familiar with, we have our doctor and then, we don't know what happens after that?
As of today, I'm still allowed to see patients who want to see me. I can't promise for tomorrow, but certainly we can, there are contact numbers that are available to the listeners to call our offices, and we'll be happy to talk to those individuals.
Talk a little bit about, and you don't have to get into detail about this, but some of the ads on TV and about the pills and the different things going on in society and mainstream media. I mean, without taking a position, talk a little bit about those. When you see those, do you get excited, or when you don't see those, do you not get excited?
I think it puts, my position is I don't like them. All right.
Okay.
I think on one hand, people could say, well, it raises the everyone's attention. Says, it raises the attention of the people. Say, we can address this. But in everything, there's a balance to everything that we do. I think it's a net negative, and a net negative because a lot of the commercials, a lot of the advertisements offer, in people's mind, 100% guarantee. If you have sexual dysfunction, or if you have urinary incontinence, urinary leakage, take this medication and you'll be cured.
100%, you're cured.
I guarantee it. I guarantee it. But the reality is it doesn't work that way. And when you don't meet people's expectations, several things occur. One, and it can be testosterone, it can be a variety of the pills, it can be a variety of surgeries that unfortunately now are advertised on TV. Whatever that treatment is, whatever that gift is, if it doesn't work, then people are angry. In anything we do, if we don't meet expectations, people get upset, angry. There's no positive turnout for that. And when expectations aren't made, several things occur. People give up. They walk away from the system and they say, the system has hurt me, it's not met my needs, and I won't go back. And so the clinics, the testosterone clinics, the injection clinics that crop up periodically and eventually they leave town because of bad outcomes, that has disenfranchised a whole population that is very difficult to get back. In the same vein, the primary care physician who hands out a pill without the appropriate diagnosis, and I'm not bouncing on primary care, they do a tremendous job. I don't even own a stethoscope. These guys know what to do with listening to heart and lungs. That's not my area of expertise. But if it's not adequately treated, if a treatment is offered and we haven't really been well thought out, because empirically the patient has asked for it, says, we'll try this, and if it doesn't work, then we'll go see Schiff or another specialist in sexual health. It's tough to get those guys back. It's tough to get those patients back, and then they're angry patients. And so at one level, we are hurting them because they're not getting appropriate treatment, but at a whole greater level, which is another passion or concern of mine, is that we have patients that are now looking for targets to their anger. And that's why we're seeing more violence in healthcare. We're seeing more aggravated patients. I can promise you, when I go and sit in my personal physician's waiting room, or if I'm taking my son to his physician and I'm sitting in the waiting room, every visit I see someone who's upset, whether it's a wait or a copay or some coverage that we expected to have that we didn't get. People are upset. And so there's a different tenor, there's a different specter of anger in our environment. In the waiting room, in the doctor's office, in the hospitals, in the emergency room, it's a very frightening event.
You know, you're going the direction that I was going to go next, so thank you for leading me down that path.
I read your list of questions while you're looking the other way.
Violence and medicine, I mean, violence and the waiting room, as you mentioned, it's happening. I mean, are you seeing it happen more and more? I mean, some people will say, no, your doctor, no, you don't want to do any violence towards your doctor, but there are people out there that want to hurt their doctors.
No question. There is no question that it goes back to this at-risk population, the population of our patients that have been disappointed. And it's fed by the politicians who talk about physicians abusing the system. It's fed by the commercials where we hear late at night, 1-800-BAD-DRUG or 1-800-BAD-DOCTOR. If you're on testosterone, you should sue because of this, or if you've had a surgical procedure that involves this kind of product, you call our law offices, we're here to help. It comes from insurance companies that say, well, you used to have this medicine that's covered, and now it isn't. It comes from patients who are offered samples of medication, and then when we find out that it works, now we write for the prescription. Oh, wait a minute, that prescription is not covered. Physicians are the cause. Angry staff are the cause. Patients are the cause. All of us are responsible for what's occurring. And it's fed by these commercials. It's fed by unmet expectations. It's fed by unsupported articles of abuse or misuse of funds. Everyone is not perfect, clearly, right? But there are issues here.
But has that changed ever since? I mean, you've been doing this for a very long time. This is your third generation doctor. In your opinion, has that changed? I mean, years ago, it seems like the doctor was the best friend and a family friend, and someone that was a neighbor was a doctor. Are you seeing the trend kind of go towards people anti-doctors or
It's
violence?
not a question of anti-doctor per se. What it is people are fed up. People are frustrated. It can be frustrated with your plumber. It could be frustrated with any professional. Everyone has regulations that they're doing their best to try to adhere to comply with. And with that, with every regulation we have, And I'm not an anti-government guy. I don't mean, I'm not coming off like this.
Right,
I'm not
right.
trying to come off like this, but what I'm saying is there's certain distractions that I have that I have to fulfill in my daily practice. By law, for instance, there's certain regulations, HIPAA regulations, where I can't talk about other patients' issues, medical issues. Now, that makes sense, right? I shouldn't disclose medical concerns of another person. But what if that is your father, or your wife, or your child, you know, as an adult child? I have to get signatures. Well, wait a minute, I'm her husband. I'm the son. Why should I'm really concerned about his health. I can't answer any of your questions until we get your father, your loved one, to sign off on that. So again, it's another wedge of the relationship that we have with our patients. Medical records, electronic medical records. People come in, if you've been to your doctor in the last 6 months, what is between you and the doctor? It used to be a stethoscope or a white coat. Now it's a computer screen. That's
Right.
not the way, that's not practicing the art of medicine. That is the frustration. And those are a few of the many causes and why this relationship is deteriorating.
Well, Dr. Schiff, we're running out of time this week on the program, but any final thoughts you have for audience members on anything that we've discussed? We have about a minute for you to give us your final thoughts.
Yeah, well, I appreciate that open forum. I think that no, I think that the bottom line is in this time in medicine where there have been a number of intrusions from third parties. It's incumbent upon you as a patient to fight for that relationship with your doctor and to fight to get your questions answered and your concerns voiced. And I think that should be the take-home for tonight's discussion.
Dr. Schiff, thank you so much for talking about some topics that people may not be comfortable about on the program today. We'd love to have you back to talk about other stuff. I could think of a ton of other things to talk to you about.
I look forward to that. Thank you for the opportunity.
That's all for this edition of San Joaquin Spotlight. Thank you to the volunteer crew that make this and every production possible. There's a group of them in the studio, and their names are in the credits after the program. Thank you for those of you watching on Comcast 93, AT&T 99. We wouldn't be able to do this show without you viewers, and also to those of you listening on KFSR 90.7 FM. Thank you for tuning in this week. Our guest has been Dr. Schiff. We'll be back next week for a new edition.